Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Study highlights 10% earnings decline in women 4 years after menopause diagnosis. Women experiencing a significant fall in earnings in the years following a menopause diagnosis, with more women stopping work and others working fewer hours, according to a new UCL study published by the Institute of Fiscal Studies. Economists at UCL, University of Virgin, Stanford University and University of Delaware calculated that women experience a 4.3% reduction in their earnings on average in the 4 years following a menopause diagnosis, with losses deepening to 10% by the 4th year. This 10% reduction in earnings is approximately half of the estimated 23% loss of earnings experienced by new mothers, also known as child penalty. The main sample looked at women born between 1961 to 1968 who had a menopause-related diagnosis between the ages of 45 to 55. The fall in earnings experienced by women during menopause was primarily driven by a decrease in the likelihood of working and a reduction in contracted hours worked, the researchers found. Cambridge team pioneers MRI breakthrough to perform groundbreaking epilepsy surgery for adults. A new technique has enabled ultra-powerful magnetic resonance imaging scanners to identify tiny differences in patients' brains that cause treatment-resistant epilepsy. In the first study to use this approach, it has allowed doctors at Eden Brooks Hospital, Cambridge, to offer the patient surgery to cure their condition. Previously, 70 MRI scanners, so-called because they operate using a 7 Tesla magnetic field, more than double the strength of previous 3T scanners, have suffered from single black spots in crucial parts of the brain. But in research published today in Epilepsy, researchers in Cambridge and Paris have used a technique that overcomes this problem. Around 360,000 people in the UK have a condition known as focal epilepsy, which causes seizures to spread from part of the brain. A third of these individuals have persistent seizures despite medication, and the only treatment that can cure their condition is surgery. Epileptic seizures are the 6th most common reason for hospital admission. Waterjet surgery for enlarged prostate. Effective relief without impacting sexual well-being. Using a high-pressure waterjet to operate an enlarged prostate can be better preserve the ability to ejaculate compared with standard laser surgery, finds research. The technique has similar outcomes to laser surgery and can be performed with robot assistance, so could reduce waiting times for men with urinary problems caused by an enlarged prostate. The Water 3 trial involved a water-based surgical procedure called aquablation, currently used for small and medium-sized prostates. The trial assessed its safety and effectiveness for use with large prostates compared with surgery using lasers. It also investigated adverse side effects such as erectile dysfunction and urinary incontinence. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.